Hi everybody. We are going to talk about developing a research question, also known as PICOT. This is, to me, the single most important task and activity in research is knowing how to write a really good research question and using PICOT to do that. And all my students and staff and people I work with will know that I always come back if we're struggling with an idea or questions of what to do. I'll always say, let's go back to PICOT and the research question. So I'd like to start with a land acknowledgement that I acknowledge the traditional owners of the land where we're meeting, which is across Turtle Island. And personally, right now, I am located and live and work on Treaty 13 territory with Mississaugas of the Credit First Nation. And just a bit of background. Of course, we're meeting because we do research. We love to do research. We love to ask questions. So I am going to go over a little bit of basics about research before we go into developing the research question. What is research? To me, research is an activity for the purpose of creating or expanding knowledge. It's done systematically. It's done in a systematic way. And basically, we walk through life and we ask questions. Could this be better? How can we improve this? Why is this that way? And it's through asking those questions where we want to do research in a systematic way and capture data and information in a systematic way to create or expand our knowledge. Why do we do research? Typically, research is done to improve the existence of humans, animals, and nature. Usually, we're trying to ask questions where we want to improve. Most of us are health researchers. We want to improve uh, uh, people and animals' health, or we want to improve society in some way through some social justice questions. There is some research and some researchers that ask questions and do work just purely for the purpose of creating new knowledge. I really respect those people. And I think it is important because you never know what understanding the cosmos, for example, is going to do for our society. And it's a very important endeavor. It's not typically what we do as health researchers, but clearly it's interesting. There's different types of research, and typically they're divided into quantitative research, which uses numbers, so you collect numerical data, or qualitative research, where you're using stories uh, for creating or expanding your knowledge through interviews, focus groups, arts-based. There's also other ways of doing qualitative research. So think about your research right now and the project you want to do. Are you thinking of it being quantitative? Are you thinking of it being qualitative? You can also do something known as mixed methods, where you use both quantitative and qualitative. If you're really using mixed methods, that means that you're actually mixing your interpretation and analysis and results of the quantitative data and the qualitative data that you're actually collecting. You're mixing those findings of those two different types and modalities of research. If you're just doing a quantitative component of your study, then a qualitative component of your study, and you're not mixing the analysis, that's actually called a multi-method study, not mixed methods. if that's helpful. Also, think about your study about whether it's going to be, you're going to prospectively enroll people. So that is forward in time. Like you have a baseline visit or a baseline time point and you're following forward people forward in time. That's or longitudinally versus retrospective. So, for example, you have people who are being followed in a clinic and you're going to go look in the chart. So the visits have already happened. So the data is retrospective. And the disadvantages of retrospective data is biases. Also, there would be more missing data. And then another type of study design is cross-sectional. So again, it's prospective in nature, but it's not. It's just one time point. So cross-sectional. And a lot of times we do cross-sectional studies because they're easy to do and cost effective. But there's also a disadvantage of bias of not assessing what's happening over time. So think about your study. Is it quantitative or qualitative, mixed methods, multi-method? Are you planning for it to be prospective, longitudinal, forward in time, or retrospective or cross-sectional? Okay. Now there's different types of quantitative studies. And when we're doing our research question and we're looking at using PICO or PICOT, it was primarily developed for quantitative uh, research studies, but I apply it to qualitative also. I think the same concept is useful. Um, and we can discuss that. So what is the definition of a cohort study? So we have CHIVOS as a cohort study, or BCC3 is a cohort study. What is a cohort study? A cohort study is a cohort is when you have a group of people that have the same characteristic. And so some of the ways to think about that is you have a population, the whole population of Canada, let's say living with HIV. And but you can't study the whole population. So you enroll people who meet the inclusion criteria and are a part of that group, are a group of the population you're interested in. Do you see that? And then what you can see when you do a cohort or when you are forming your cohort, there's going to be questions you're going to want to ask about your cohort, or we're always trying to eliminate biases. And those questions will be things like, what are you doing or to have your cohort similar to the full population? Or how similar is your cohort to the full population? Is it representative of the full population? And that's when, for example, your recruitment strategy becomes very important and very important to put in a grant is your recruitment strategy. Because what are you doing for your recruitment strategy to reduce biases, really have it be representative of the full population, and not miss people? Because often there's people that are missed who don't want to participate in research. And then whether in your cohort you're assessing uh, what's different about your cohort versus the full population that you're interested in serving. Is it how similar or dissimilar is it? And can you do that analysis? So, for example, can you compare those who agreed to participate versus those who didn't agree to participate? Does your research ethics and design allow you to do that? And these are questions you have to consider before you submit to REB, because if that's not in your research ethics submission and approval and in the consent, then you can't do that. Usually a cohort study is defined as prospective. So you have a group of people that meet a certain definition or criteria and have a characteristic in common, and you follow them forward in time. Do you see that? But it can also be retrospective. Uh, um, uh, there's something called a case control study, which is actually retrospective, where you look at people who had let's say a certain disease state, like lung cancer, and then you compare them to controls for the people who don't have lung cancer. And then you look in the two groups to see if there's risk factors that were more associated with the disease state or not. So, for example, smoking would be the classic case control study. Other study designs, quasi-experimental study designs that I like, but grant reviewers don't like, which is a pre and post study. So you have one cohort and you assess them before you do an intervention. You do your intervention and then you assess them afterwards, because really the gold standard is a randomized control trial where you're not doing pre and post of one cohort. You have a cohort and you randomize them to either receive an intervention or to receive the comparator group. Okay, so that is setting you up. Um, that is setting you up to start looking at the research question. Of course, there's other types of study designs you might be doing. If you're doing if you're doing a PhD, for example, or even a master's, you might consider doing a scoping review. You might be doing a systematic review or meta-analysis, or you might be doing an environmental scan. And in my mind, using PICO or PICOT and developing a research question applies to all of these different study designs. So when you move into um, doing your research question, it doesn't include your study design. So when you're writing up um, when you're writing the objectives, for example, of your study, your first line might be our study design is, and these are the items you want to answer. Is it um, is it quantitative or qualitative, prospective or retrospective, or cross-sectional? Is it a cohort? Is it quasi-experimental, randomized controlled? Um, or is it one of these study designs? So this part is not included in the research question, but being really clear on what your study design is important and being able to articulate that in a sentence. Okay, let's get into the research question. So, Cameron, are you there?
Yep.
And Cameron, you're a MPH.
Yes,
Um,
I'm MPH student at U of T and currently doing my practicum with you, Mona, and we're working on the Women-Centered HIV Care curriculum.
okay. So, are you okay if we use the Women-Centered HIV Care curriculum as an
Yes.
example
Yes,
for
let's use
research
it.
question? Okay, great. So, a well-built research question has 3 to 5 components. Okay. And sometimes a component is not applicable. So we're going to go through that. You will always have a population. So that's P. You usually have a I, which is intervention or independent variable. The C is for comparator group. And then the O is outcome that you will always have. And then the one that's often dropped is T, which is for time. I like to keep it, but for example, systematic reviews and scoping reviews, they just use PICO. So you'll hear both PICO and PICOT. And really don't rush in developing the research question. A well-framed and written research question greatly improves the quality and the utility of the answer. Why is a research question important? It really allows you to know how to best do your study design and really clarifies a lot of those items you're unclear about. Okay, so and this is a part of research that is my favorite because I think it's the most fun, but it's often missed and not there's not enough time spent on it, which is the brainstorming phase. And really, it's like free speaking about why are you interested in this topic? What are you passionate about? What do you see in the world that you want to understand better? Or what do you see in the world that you want to change? That's driving you to ask this research question. What are you observing? What patterns interest you? Um, and you're asking, why is this happening? And then you often will do literature review and to look at what prior research there is. So what prior research is there about the topic and what's been answered, but what hasn't been answered? What's the gap that's informing your research question? And we talk about something that really comes from the randomized control trial world called equipoise, that really you can't ask a research question particularly in a clinical trial if there isn't equipoise, meaning we really don't know the answer to this question, and so that it's ethical to continue with the research study. Okay, so here are the components of the research question. P is for population, as I said. I is for intervention, which if it's a randomized controlled trial or a quasi-experimental pre-post study design. But if you're doing a quantitative, just simple analysis, or even qualitative, what's your independent variable of interest that you're going to ask about? And how this can apply for qualitative work is, what are your questions going to be in your interview guide? Do you see? So are there particular independent variables of interest that you're interested in? And the independent variables are the ones that are different than your outcome, which is your dependent variable, right? So then C is for comparator group. So in a randomized control trial, that would be you would have your intervention group like drug A versus drug B, which would be usually the standard of care. Independent variable, I also think of it as the independent variable versus comparison group. So for example, you could take age, for example, and do a cutoff of, let's say, 40. And now, so let's say over 40 is your independent variable of interest, and the comparison is under 40. Do you see that? That's how I use PICO and the research question, even to answer a simple question of database analysis that we would be planning to do. So that's the C for comparison. And then the O is outcome. And to me, the outcome is so important. Really thinking about what is the most important outcome that we're interested in. Okay, so really spend time thinking about that, and we will we'll get to it a little bit more. And the outcome is not what it in this case, developing a research question, the outcome is not the outcome of your project. The outcome of your research question is, what is the variable? What is the dependent variable that you think is the most important that you're interested in assessing in this population, in this cohort of people? So is it quality of life, for example, would be an important one, or a specific health outcome. Okay. It's not the outcome of your project as a whole. I really like time. It comes from the randomized control trial world where you want to assess an outcome. Your primary analysis is the outcome is being assessed at a particular time point, like 1 year, for example. But I like to use time. You can use time for other considerations, like how long are you going to enroll your population for? So that's like enrollment time. How long are you going to run your study for? And again, at what time point are you going to do your primary analysis? And then you might have secondary time points in analysis. So when are your secondary time points? Typically, you have one primary outcome. And so you have one which would be assessed at one primary time point. Do you see that? Okay. 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 So, Cameron, tell us about your project.
So, in terms of the curriculum, we're currently developing the Women-Centered HIV Care curriculum, which is going to be a very comprehensive educational tool with about 15 modules spanning many different topics, including um, information on like person-centered care or information on mental health and or substance use, information on menopause, just essentially a really comprehensive look at what clinicians and healthcare providers might want to know in terms of caring for women and gender diverse people living with HIV. So that's, I think, a bit of a synopsis in terms of the intervention, like the curriculum. Um, and then we want to try and pilot this curriculum in a group of healthcare providers and look at um, their shifts in knowledge relating to women-centered HIV care, trauma and violence aware care before and after the use of the curriculum. Yeah, that's a bit of a synopsis, I think, of the project.
Um, So for the research question, this is last year's project that we used an example. Can the Women-Centered HIV Care Clinic Implementation Package be effectively implemented in Ontario HIV care clinics by training clinic staff and running peer-led workshops with women and trans and gender diverse people living with HIV? And what factors influence its adoption, fidelity, acceptability, and scalability? This is not the best research question because you can see some parts are okay. So, for example, maybe the population is okay, but you can see the outcome is really not clear. So, do you see why it's really important to spend time on the outcome? And also, there's no time point. So, let's dive into it a little bit more. So, when you're writing your proposal, like let's say your master's proposal or or for a grant or your REB protocol, you're going to have a section for your study population. And usually what you do is you start that section describing your overall population that you're interested in words. So, for example, what we wrote is women, so cis and trans women and gender diverse people living with HIV. So that's sort of the written population in words. But really, we might want to be more specific. That might not be specific enough because um, for the population, there should be what you can see there is very clear inclusion exclusion criteria. So, what's the age of the people we want to enroll? So maybe it would be better that it's adult women and gender diverse people living with HIV, and they have to be actually receiving care at those participating clinics. So you want to be more as specific as possible when you're defining your population. So, sometimes, like in a qualitative study, you you know if your study is really exploratory You might not have to be that specific, okay, even with the outcome. But when you tease into it a little bit more, there's potentially two other study populations. One will be the training of the clinic staff, but also peer facilitators. So that sort of complicates the research question. So let's move for the project from last year, the intervention was the Women-Centered HIV Care Clinic Implementation Package, which has two components, the training of the clinic staff, and then the second component was the community peer-led workshop. And all together is considered as the intervention. And then for this project, because it is a pre and post, you can see that there's no comparison. There's just an intervention, and it's really the pre and post is the pre is considered the comparison portion. Do you see that? Um,
Yeah.
okay. How about same with yours, right, Cameron? It would be pre and post.
Yeah, it would be pre and post, yes.
Okay. Okay, so let's get to your point. Which is what is the outcome? What is the dependent variable for your project? To me, it's probably the most important component and
Hmm.
the one that people really struggle with. So we have, can the Women-Centered HIV Care Clinic implementation package be effectively implemented in Ontario HIV care clinics by training clinic staff and running peer-led workshops with adults, women, and trans and gender diverse people living with HIV to blank? What do we want to assess? For the project from last year, you see the first version of the research question was the outcome was really broad. It and because we listed all of these implementation outcomes. We using re-aim, reach, effectiveness, adoption, acceptability, maintenance, scalability. But really with a research question, there's one primary outcome and one primary research question. So you have to take this long implementation science outcome list and pick just one. And so typically we would pick effectiveness or adoption, for example. We decided to use the healthcare empowerment inventory scale. So that is a scale where the women and gender diverse people with HIV would fill out the scale before the WCIP intervention and after. Again, time is important for knowing when you're going to measure your primary outcome. And again, we discussed how you can also consider time for how long are you going to enroll for. How by the end of our discussion last year, the research question was tightened up to ask, can the Women-Centered HIV Care Clinic implementation package be effectively implemented in Ontario HIV care clinics by training clinic staff and running peer-led workshops with women and trans and gender diverse people living with HIV, and what factors influence its implementation, measured using the re-aim outcomes, with effectiveness being the primary outcome, measured using the Health Empowerment Index before and at 3 months. So with one time point after the
Hmm.
workshop. Okay. And you can see how it sort of developed over our discussion. So putting it all together, enjoy doing the brainstorming portion and don't rush it. Map out your PICOT. And really think about what the best study design is, and think about when you're thinking about your outcome, what is the most important aspect? For example, in care, or what's the most important aspect for women and gender diverse people living with HIV to ask, like, what do you really want to measure as your primary outcome? And we're done.